All right, we're going to try this again. How's it going, Mark? All right. Mark says we're good to go now. So I will welcome you again to Monday, February the 1st, the first day of a brand new shiny month here in Mobile, Alabama. We're glad to be bringing you our Monday 2:30 Facebook Live update of the impact of the COVID-19 pandemic on the world in Alabama and Mobile County. So worldwide, over 103 million cases with over 2.2 million deaths, just incredible numbers. In the U.S., we're over 26 million cases of COVID with approaching 500,000 deaths. And in Alabama today, reporting on 460,860 COVID-19 cases with just under 7,700 deaths in Alabama. So in Mobile County today, we're reporting on our daily report 33,290 cases of COVID-19. 98 were added yesterday. 191 were added on Saturday. 133 on Friday. So it still looks as if we're seeing maybe a leveling of the number of cases reported to us. The total number of Mobile County residents who have died with COVID stands at 613. None were added yesterday. We did see a few added over the weekend. The cumulative number of people hospitalized with COVID-19 is 4,181, 22 new hospitalizations yesterday. And then that all-important, how are our hospitals doing? Let's see, I think yesterday, there were 223 people in Mobile, Alabama hospitals with COVID-19. That was an increase of 7 the day before, but in general, it is going down slightly. So we are excited about that. You know, you've probably heard that nationally, it looks like we are coming off of what may be a January peak. We will continue to monitor that closely. But in Mobile County, it's the same way. When we look at the number of cases reported, we had fewer reported last week than the week before. Looking at the number of people hospitalized, it appears to be going down. So the number of people hospitalized on any given day. The number of emergency department visits for COVID-like illness is plateaued a bit. We're still seeing an increase in reported deaths. Again, and by week of death. So if we look at the week of death, looks like we had around 25 on this report. It looks like we might be missing a week. So I need to check on figure 8, everyone. So that one might need to be updated. We'll take a look at this and get back with you. But we know the deaths always lag a little bit behind hospitalizations. So it wouldn't surprise me if we continue to see kind of a high number of deaths for the next couple of weeks. And then that all-important indicator about the number of tests that are positive. So the number of tests positive over the total number of the test, the percent positive is down statewide to around 14%, and that's looking at our traditional public health surveillance systems, which is a mix of mostly PCR, but also some antigen tests, and the mobile clinics or the urgent cares that are still doing a high volume, very high volume of tests each week are still seeing percent positives in the 20% range. So still very concerning to see such a high positivity rate. And I just wanted to see if I could read these zip codes, and I can't. But some of our highest areas, again, 36572, that has continued to be a hot spot for COVID. And it looks like maybe some other far eastern zip codes in the downtown area, the more metro area. So I also want to just comment briefly on sort of what we're seeing in other parts of our community, not just cases, but for example, our nursing home facilities and assisted living and specialty cares, we still have outbreaks in about a dozen or so long-term care facilities, but several have been declared COVID clear, so that is good news. We still have outbreaks that are going on in congregate settings, so not a traditional, nursing home per se or long-term care facility, but congregate settings where, adults with disabilities are housed or things of that nature. So we have several of those settings where we have outbreaks. We have cases at some senior living apartment complex that we're continuing to monitor. So those things are really hot on our to-do list to try to assist and guide and advise. And then with the work that we're doing with the community, we still are talking to, through complaints or just consultations, talking to big box stores, big discount stores, barbers and hair salons, consultations with about 7 school systems, 3 or 4 permanent establishments like restaurants or other types of food vendors, and then sort of miscellaneous, work centers, churches, lots of churches, social club areas, that sort of memberships, those sorts of things. So again, remember that gatherings are a very high risk opportunity for COVID transmission. So anytime you are in an area, particularly if it's indoors, and you are around people who don't live in the same house as you, this is a gathering, and that is just ripe for COVID transmission. So we're seeing transmission at funerals, at other religious activities, face-to-face church services, for example, Bible studies that are, supporting community transmission, and then lots of living room transmission, so families that are continuing to gather, though it does look like it's not quite as bad as it was during the holidays for understandable reasons. So next on my list, let's talk a little bit about vaccine. And Dr. Chavers couldn't be here with us today. He's working on our clinic, getting that ready to go for tomorrow. So I just wanted to sort of give you some numbers about the number of doses in Alabama. So we have in the state of Alabama, just over 195,000 doses of Moderna have been administered. Just over 164,000 doses of Pfizer have been administered. So that puts us right at 360,000 doses of COVID vaccine administered to just over 300,000 people. So there are about 55,000 people who have already completed their second dose. In Mobile, about 30,000 people have received at least one dose. That's, I think, about 7% of our population. But again, that number includes both first and second dose. But we still have a critical shortage of COVID vaccine. In fact, for the health department, it's gone from bad to worse, because we had been receiving, 500, then 2,000, then 900, and we were really hopeful that we would see that number, stabilize maybe around the 2,000 mark. But the state health department has made some difficult decisions about distributing vaccine, and they have decided to allot about 1/3 of their Moderna allocation weekly to local health departments, which includes Mobile County, and have determined that the Mobile County Health Department will receive enough vaccine to vaccinate 400 people weekly. So for the short term, that's as much vaccine as we are going to receive from the state Moderna allocation. We are looking at other ways that we might be able to maybe partner with hospitals to assist them in vaccinating if they have Pfizer vaccine that has not been used. But the health department, starting this week, going forward, we had some commitments this week that we're going to uphold, but we will only be able to do, starting next week, we will only be able to do second doses and 400 first doses. And that is going to severely limit our ability to get around to everyone who wants vaccine. So just to a couple of announcements. On Friday of last week, this came up right Friday afternoon while I was doing Facebook Live. The state health department last week said that starting February 8th, so starting next week, they will expand COVID vaccine eligibility to include people over 65 and anyone who's in the 1B eligibility requirements. So on Friday afternoon, Dr. Eichel, the county health officer, announced that that Mobile County Health Department's clinics that are scheduled for this week that we will go ahead and extend to the new criteria. So let me be more clear about what that looks like. Hold on a second. Let me just pull it out because I don't want to get it wrong. Then have everyone calling me and wanting to know what I said. Okay, here we go. So this week we have clinics scheduled on February 2nd tomorrow at our Sims location. February 4th on Thursday at our Citronelle location, and Saturday, February 2nd at our Mount Vernon. These are first come, first served clinics limited to 400 people. But these are the eligibility requirements. Anyone 65 and older, healthcare workers, frontline workers, security agencies, Homeland Security, cybersecurity, first responders, of course, they have always been included, correctional officers and support staff, food and agricultural workers, U.S. Postal Service workers, manufacturing, grocery stores, public transit, educators, judiciary, clergy ministers, and state of Alabama continuity of government strategy. So legislators, Supreme Court, judges, appellate judges, constitutional officers, and cabinet leads. That's a big old long mouthful. And again, it's going to be, you have to be patient with us. It's going to be rather difficult to try to document eligibility in some of these categories. We've had people already ask us, well, I work at a food bank. Does that count as grocery store worker? And we would include that in, a critical infrastructure supply, because there are lots of people out there that we need to continue to provide food to, who are maybe struggling a little bit or maybe just needing a little bit of assistance getting by. So please, everyone, use some common sense. Have patience when you get to one of our sites, or any site for that matter, because this category takes us to about 1.4 million people statewide who are now in the eligibility category, and we did not get more vaccine. There is no more, we're not open it up to this because we have so much vaccine. We want to give it away. In fact, for the health departments, our ability to vaccinate is actually going dramatically be reduced even as these new categories are opened up. So please have patience. So to get more information about Mobile County Health Department vaccine clinics at those 3 locations, go to mchdcares.com or call 251-410-MCHD. That's 410-6243 on information on these 3 first dose only, first come, first serve, either drive up or drive through, that are taking place on Tuesday, Thursday, and Saturday of this week. All right. We're going to try to get some more social media out today or tomorrow, so that you'll have some maps about how the traffic will flow around those sites and where you need to enter to get to queue for those vaccines. Okay, on to some announcements that I just wanted to share from other sites. Today, the ADPH, the Alabama Department of Public Health, they released information on their plan for vaccine at county health departments. And there is a new portal that can be accessed at alcovidvaccine.gov. So that's alcovidvaccine.gov, alcovidvaccine.gov, all one word, COVID vaccine. And you can go there to see if you qualify for scheduling an online appointment at this time, or if you want to queue for future availability, or for counties, health departments like Mobile, where we are not taking appointments, we're doing it by first come, first serve. There is a link to walk in and drive through clinics, and you can find information on our clinics at that site. But again, that is primarily for Alabama Department of Public Health, the 64 county health departments that fall under coverage by ADPH. Also, the state health department announced today a vaccination clinic at OWA in Foley on Tuesday the 2nd and Thursday the 4th. So this is tomorrow, Tuesday the 2nd, and then again on Thursday the 4th. Depending on vaccine availability, the clinics will operate from 9 a.m. to 3 p.m. And again, vaccines given on a first come, first serve drive-through basis. And their eligibility now, because they're with the state health department, it's 75 and over, healthcare workers, law enforcement, firefighters. So this week at OWA, they're sticking to the current eligibility statewide. The state will roll out next week to that extended eligibility. Also, just to mention that the University of South Alabama, in conjunction with the mayor's office and the civics at the Civic Center, they updated today that they had been giving about 500 per day. That this week they're moving to 800, and next week, the USA is participating with 7 other hospitals in the state to have a 5,000 in 5 days initiative. They hope next week to give 1,000 vaccines a day, Monday through Friday. And to determine eligibility for the University of South Alabama site at the Civic Center, you need to go to c19vaccine.southalabama.edu. So you answer a few questions to see if you're eligible at this time. If you are eligible, then you will get some information to invite you to schedule an appointment. If you are not eligible, you can elect to queue and receive future information when you can go online and make an appointment. So please, anyone, if you're a 25-year-old and you want to get vaccinated one of these days, you can go there and register your intent to receive information. Again, it's c19vaccine.southalabama.edu. They are open Monday through Friday. All right. I need some water, Mark. No, that's okay. It's okay. I can do it. I'm fine. It's a long one today. Okay, so a couple of media questions and Facebook questions. Let's see. Asking for the latest vaccine status from the Mobile County Health Department. So again, we have 3 drive-up or drive-through clinics scheduled this week. So this week we plan to give 1,200 doses. And then beginning next week, we will be giving booster doses, and we will be giving 400 first doses, that based on the limited supply and the very small allocation of vaccine that the county health department is getting from the state allotment. Let's see, looking for information on how, thank you, Mark. So someone asking about how the announcement affects the clinics. So even before it was announced on Friday, we had people sort of, rushing down to the cruise terminal, had heard that it was going to be expanded and wanted to get vaccinated. 1 second, please. So then when the announcement came out, it got even worse. So we do expect that this expansion, again, in Alabama and Mobile County, I think it expands to include about another 100,000 people. So I think we're around about 160,000 people that are now eligible for vaccine, a lot of people. And we do expect it's going to put pressure on our clinics. We have a much larger pool from which we can vaccinate, and we're doing our best to deal with that. So please, again, check our website and be prepared to wait and come, with some food and drink maybe in your car, and appreciate all of your patience as we try to get the 400 doses out tomorrow that we have. Someone asking, I've gotten this question a lot. It basically comes from family members who have maybe parents, maybe grandparents or aunts and uncles who are bedridden, who are homebound, and cannot leave their home to go and get a COVID vaccination. I currently know of no organization that is doing home-based vaccination. We recognize that this is a high-risk group. It's also a very difficult group to reach, but we're counting on the fact that several hundred providers in Mobile County have registered and been approved to receive COVID-19 vaccine. That's part of the reason that the health department allotment is going down, because they are trying to get more vaccine out to individual providers so that home health agencies or dialysis centers or hospice care providers will be able to get vaccine in their offices to deliver to these very unique patient populations, that are homebound or, can't easily travel to one of the drive-through or drive-up locations to get a vaccine. So please keep an eye on, talk to your normal care providers to see when they will be able to provide, those home health agencies, when they might be able to provide vaccine to people who cannot leave their home. Someone asking, they deliver medical lab specimens. Would they be eligible for the vaccine? So when I read that half of the sentence, delivers medical lab specimens, then I would say, yeah, you're probably eligible because you work in a health care setting. The second half of that sentence is, was this person also delivers bread for hospitals, restaurants, and hotels? So that one's a little bit less clear to me, but you probably would be eligible. Again, take verification of your employment. Another question that some reports, we've heard this frequently, that there are reports that providers are holding back doses to make sure that they have the second dose booster available to them, and wanting to know if that's happening in Mobile County. So I can really only speak for us. The Mobile County Health Department had not been holding any vaccine. We have been giving it as quickly as we received it, expecting that the second doses were already accounted for. And I truly believe that that is the case. However, now that the state has said we're going to allocate you 800, and that 800 is first and second dose for 400 people, we may have to hang on to that vaccine so that 4 weeks later we're able to give them that second dose. So these things are changing all the time, and we are just trying to adapt as quickly and as resilience as we can to try to get as many doses out as possible. Also, this reporter was asking, so CDC says they're giving 3 weeks of data now to states on arrival of vaccines. Will that help with planning? Yes. The more time we have to plan, the better it is. I think on Friday at 2:30, I said we still had not found out what our allotment was going to be for the week. And I didn't get that email until about 4:15. So on 4:15 on Friday, I found out that Mobile County's allotment for this week is 800. So we are planning all over the weekend about how we're going to get those out. So if they can do it a couple of days earlier, a week earlier, 3 weeks earlier, that is a big help. And we are grateful to the State Health Department for saying that they would commit to a standard weekly allotment so that the county health departments can plan. We're disappointed it's only 800 doses, but we are grateful that they said they would commit to providing us 800 doses based on what they've heard from the federal government that they will receive over the next few weeks. So that is good news. So yes, it is a big help. All right. One last thing I want to communicate. This is a question that I get a lot from my coworkers and my family members, so it means that I need to say this again and say it loud, and hopefully you will hear and share the news. Do I need to wear a mask and avoid close contact with others if I've gotten 2 doses of the vaccine? And the answer unequivocally is yes. You still need to wear a mask. You still need to social distance. You still need to wash your hands and do all of those things that you need to do, because we're still developing, still gathering, still reviewing the science and data and information, and CDC will make a determination of when it's okay for people to stop wearing masks or stop social distancing. It likely will not be anytime this year, or at least not before summer. So we just want to make sure that you keep doing those things so that we can understand sort of in a real world setting how things will be impacted. Like, for example, it depends on how the virus is spreading. It depends on the the efficacy of these vaccines on the new strains that are circulating, have to determine if the vaccine works as well against some of the variants. We need to learn if transmissibility goes down, or just disease goes down in people that are protected with 2 doses of vaccine. So it will be really important for you to do the things that you need to do to, deter transmission, wearing a mask over your nose and mouth, stay 6 feet away from others, avoid crowds, avoid gatherings, avoid poorly ventilated spaces, do things outside when you can, and wash your hands often. So again, do I need to wear a mask and avoid close contact with others if I've gotten 2 doses of the vaccine? The answer is yes. You must still do those things to try to slow transmission. All right. Got one question coming up.
How many vaccines per clinic? The 400.
Okay. So the question is, how many vaccines is Mobile County Health Department going to be delivering at each clinic? We will give 400 on Tuesday, 400 on Thursday, and 400 on Saturday. That is our allotment for those 3 clinics. All right, Mark says he thinks that gets to the heart of it. All right, thank you all for your patience. We're always a little longer on Monday than we are on any other days. Please enjoy your week. Keep yourself safe and happy, and have a great week, everyone.